Perioperative surgical home is a care redesign model to focus on the patient who is undergoing the perioperative journey. The perioperative surgical home would be something that is created with the collaboration of the hospital, the surgeon, other caregivers, that enhances the patient's journey for the purpose of improving their outcomes. Now, the outcomes could be anything from their length of stay, their pain level, revisits or readmissions, and also the patient satisfaction. So what it does is it allows a patient to have a seamless, navigated pathway from the point where the decision to do surgery is made by the surgeon all the way to maybe 30, 60, 90 days after the immediate acute phase. So it really has to connect the preoperative stage, which could be a few days, a few weeks, maybe a month, depending on the patient. They may need to have some education or prehabilitation, what we call prehabilitation, to make sure that they're strong enough for the surgery, all the way to 60, 90 days after the surgery to make sure that all of their recovery needs are met in a most patient-centered and cost-effective manner. So the periop surgical home could entail an actual clinic at the hospital, or it could be a coordination of different offices, so like the surgeon's office to the pre-op testing area in the hospital. Some hospitals actually have a physical clinic, but as long as we're using a coordinated way of using technology, the electronic medical records, telehealth even, and all of the stakeholders and all the providers such as pharmacy, physical therapy, nutritionists, all of them are involved through a coordinated pathway, then it's easier for the patient to understand exactly what they're supposed to do, what they need to achieve. Very much like if you were to run a marathon, you wouldn't just say, well, in 2 weeks I'm going to run a marathon. You have to train for it, which means you have to get prepared for it. And surgery is very much like that. You have to prepare the patient to make sure that they'll have the best outcomes. And so putting all those resources together for the sake of the patient in a standardized evidence-based pathway is what we call the perioperative surgical home. Now, it has to be customized for every individual hospital, because every hospital has their own capabilities, their own market, and their own way that the physicians engage with the hospital. These protocols for that the periop surgical home can implement are actually evidence-based and well published. So one example is the enhanced recovery after surgery protocol for colorectal surgery. Now, enhanced recovery protocols are starting to be developed for all sorts of other surgeries, even vaginal births, C-sections, urologic surgeries, orthopedic surgeries, and spine surgeries, and so forth. The one that I'll be discussing during my talk specifically uses colorectal surgery as an example, but these are enhanced recovery protocols that have been published and are evidence-based. So nationwide, everyone can agree on exactly what components of care should be included in each of those steps.